Alors bonjour tout le monde.
So hello everyone and welcome to this press conference from the Regional Director of Public Health of Montreal, Dr. Mylène Drouin. As we do it every time, Dr. Drouin will start with a speech in French, followed by one in English. After that, we will go into a question period in French and English. We ask journalists to please let us know that they are there at the email address that we already transmitted to you. You'll be able to ask your questions over the phone. A reminder, once again, please keep your phones in mute mode to avoid any sound feedback. I would like to remind you that this conference is being broadcast live on the Santé Montréal Facebook page. Dr. Drouin.
Bonjour à tous.
Hello, everyone. So today I'm alone for this press conference. We are going to take advantage of this to have an overview of the epidemiological situation in Montreal and a return on the population and measures that we have taken in the course of the past few days, as well as new interventions that we plan on installing in the next few days. So as of yesterday, 9 p.m., we had 2,090 confirmed cases in Montreal, 132 hospitalizations, 26 people in intensive care, and 14 deaths. I would like to offer my condolences, my most sincere condolences to all the family and loved people in that family. So that's new cases compared to yesterday. But as I told you, we had to be very prudent in the estimation of the new cases, since we know that we had a lot of backlog at the labs for the past few days. So we, of course, were expecting that there'd be new cases added today and in the next few days. There is, however, some good news. That is, in the past 4 to 5 days, we have reached stability in the number of new declared cases. We haven't doubled or tripled. The proportion of hospitalized people or needing intensive care, as well as the proportion of people dying, is inferior to that which can be seen in other countries, and we do therefore have further cases with lighter symptoms. As far as the geographical distribution is concerned, which will be accessible on the website of the Direction Régionale de Santé Publique, we can see that certain boroughs are more affected than others. However, for almost all the boroughs in Montreal, we are now presenting community transmission. I therefore wish to reiterate the importance that when we are in a community transmission in a region, it is not justified to confine or to close one borough or one sector rather than others. The barriers that would be set up right now, or the roadblocks that are set up in other places, all what we call the sanitary measures, those are indicated when we have a territory when there is no community transmission and we wish to protect them from another territory. That is not the case in Montreal. That is why the measures that we are deploying to the entire island of Montreal. We are also worried by the outbreaks that are ongoing in our homes for the elderly and CHSLDs. It's over 13 residences right now that have over 2 cases, and we have 3 CHSLDs with outbreaks that we judge to be significant. As I said, we are, as of today, making available the data on the Santé Montréal site, a few guidelines for the population. For the people who will be developing symptoms, since we are in a period of community transmission, and that regardless of whether you have a lab test or not, it is primordial to remain at home and to isolate yourself for 14 days. To that effect, you may consult on the website the self-care guide, which will be distributed to the entire population by the government of Quebec, and which clearly indicates what to do during the period where you have symptoms. But it is crucial that you remain isolated at home. For all other Montrealers that have no symptoms, continue with social distancing. You can certainly go for walks, but respect the 2-meter distance. When you go out to go to stores, only go when it is essential. So you don't go to the grocery store every day. Go once in a week and buy everything you need for that week. And of course, avoid as much as possible going from one neighborhood to another when it is not essential. Of course, hand washing remains the most important measure to apply at any time when you come back home. The measures that we've taken in Montreal over the weekend, in which I announced, have been set up since we were in community transmission. Already, since the weekend, I have emitted over 10 individual orders for people who were more recalcitrant and who were not respecting these guidelines, mainly in residences for the elderly, intermediate resources, or shelters. What we wish today, and what we will be adding as measures today, has to do with people who live in multiplexes, so places where there is a great concentration of housing and where we know that there is a sharing of common areas, whether they be the staircases, the entry halls, or the elevators. As of tomorrow, we are going to start speaking with the owners of these multiplexes, condo buildings, to remind them of the importance to reinsure the hygiene measures and also to avoid that there be visitors and people who shouldn't be there who come into the buildings. Moreover, we are going to be working together with our partners in order to set up a more specific intervention in these big buildings where we have declared cases. Respecting people's confidentiality, the confidentiality of people who are affected, we will find a way for people to be able to know that there are people affected by COVID in that particular building, but of course we will be asking that there be a significant enhancement of the hygiene measures in those areas. In certain countries, this has already been done, and I think that in the Montreal urban context, where we have a lot of apartment buildings, it is very important that these places have better hygiene and that the most fragile people with chronic diseases or who are immunosuppressed, if there are cases within the buildings, they will have to be more vigilant in their isolation. We've also asked the police force of Montreal to increase their presence in the parks to make sure that the measures of social distancing be respected. I repeat it. We do not wish to close down the parks. We judge that at this stage, if the social distancing measures are respected, spring is arriving. We wish for people to continue being able to go out for walks. Please do respect the guidelines. It will allow us to keep the parks open much longer. A last word on the measures taken for workplaces that are still open. First, I wish to thank the workplaces that have significantly increased their social distancing measures as well as their hygiene measures, whether it be in supermarkets or other food stores or pharmacies. It is very important, and we need that you remain open for a long time still. If you work today, it is because you are considered as being an essential worker. It is therefore primordial as this essential worker that you respect the hygiene measures and the guidelines. If you are an essential worker and that you are symptomatic, you must absolutely be removed from your place of work because we want to keep these places of work open. And we ask workers to not ask, we ask that no doctor's note be asked for people who do not show up at work. We cannot afford to have doctors use their time on doctor's notes. And of course, when a place of work that is essential has a positive case, it is primordial to collaborate with our teams in public health because we'll be working with you to make sure that we protect all other workers and that we set up the safety measures to ensure that you be able to remain open a long time. To conclude, don't go out unless it's necessary. If you do go out, respect the 2 meters, and when you come back home, please wash your hands. Thank you.
A few words in English. Today I will do an update on the Montreal situation, and we'll talk a little bit about the additional measures that are going to be put in place in Montreal. As for yesterday, we had 2,097 cases confirmed, 132 people hospitalized, and 26 persons in intensive care unit. We had 14 deaths among elder people, and I would like to say my sincere sympathies to the families. The good news is that during the last 4 or 5 days, we do not have an increase in the number of, a significant increase in the number of new cases that have been declared. And the proportion of people that are hospitalized or in intensive care unit are really less than what we have seen in other countries. And of course, the presentation of the majority of cases are with symptoms that are not as severe to need medical assistance. We know that some neighborhoods are more affected than others, but still almost all neighborhoods of Montreal have community transmission at this time. And this is why we do not recommend at this time that one neighborhood be more isolated or confined than another. The recommendation that we're putting in place are for all Montrealers and all neighborhoods. We are still preoccupied by the outbreaks that we're seeing in CHSLD and elders residency. We have more than 13 outbreaks at this time and 3 major outbreaks in 3 CHSLD. And we will, the data are going to be available on our websites. For the population, some recommendations that we want to reinforce. For people that have symptoms, because we are in a period of community transmission, and even though you do not have a confirmed result from laboratory, it is crucial that you stay isolated for 14 days, and we recommend that you consult a guide that has been produced by the government to manage and care yourself at home. For other Montrealers that do not have symptoms, we want to reinforce the recommendations to keep the 2 meters and the distanciation. If you go out of the house, it is for necessary needs. If you walk, you keep the 2 meters. If you go for a walk, and of course, we invite you not to go in other neighborhoods if it is not necessary. We are going to add new measures in the next few days, and those measures are specific to Montreal because we know we have a lot of multiplex, donc blocks or apartments or condos, and we know that in those spaces there are many common spaces, shared spaces like elevators, staircases, or halls. So we are going to ask the owners of those buildings to reinforce hygiene measures and to secure the access so there's no more visitors. And we are working with our partners to have specific interventions in those blocks where we know we have cases of COVID-19 to make sure that people who live there know that there are cases and that we reinforce the hygiene measures in those buildings specifically. We've also asked SPVM to increase their measures in parks to make sure that the 2 meters and distanciation measures are well respected. I will finish with recommendations for businesses that are still open. And I would like to thank them because we know that most of the grocery stores and pharmacy have put in place more measures to make sure that distanciation is well done and hygiene measures. And if you are a worker, if you're still working right now, it's that you're considered as an essential worker. And it is essential that those workers do respect the 2 meters and the hygiene measures. And if a worker right now is sick, it is crucial that the worker stays home because we do not want to close our essentials businesses. And we ask businesses not to ask for a medical proof for workers who are sick, because we cannot ask the clinics to accept those workers. And at the end, I would like to say that it is important to collaborate. When a business has a positive cases, it is really important to collaborate with public health, because we will work with you to protect other workers in your businesses and to put the measures necessary to be sure that you can stay open for a long period. So at the end, in conclusion, I would say to the population, go out only if it's necessary. Respect the 2 meter when you go for a walk, and when you come back, wash your hands, please. Thank you.
Merci, Dr. Drouin.
Thank you, Dr. Drouin. We'll now proceed to the question period. I will name the journalists that I've already contacted. Please stay on mute until your name is said. You will have the right to one question and one sub-question. Mr. Coutu of Radio-Canada. Hello. You mentioned that there was no question of closing down the parks right now, but is that something that you would think about doing if people do not respect the guidelines? Of course, it is part of the measures that could be in the graduation of measures if people do not respect the guidelines of social distancing with the spring coming up and people gathering in parks. We could have to make a decision such as this one. But for the time being, we prefer asking the police to be more present, and if the population collaborates, we will be able to maintain that freedom of movement outside for longer so that people can appreciate our parks in Montreal. So you're saying that police officers will be more present. Is the approach more repressive in the sense that they will get tickets, or is it much to just give warnings? Well, as we had mentioned, over the weekend, I'm losing a bit the notion of which day it is, police officers are going to go gradually. They are first going to warn people. And if they see that people do not cooperate, they now have the power to emit an offense report that could go up to a fine.
Question maintenant, encore une fois de Radio-Canada, cette fois de Romain Chuet.
Romain Chuet of Radio-Canada.
Bonjour Madame Drouin, j'ai deux petites questions. La première, il y a été question de la fermeture des parcs. Il est question d'une autre évolution.
There's a question of another possible closure. For example, in great cities, in big metropolis, where there's an important population, there's the idea of closing down certain streets at certain times to increase social distancing. Do you think that Montreal should go down this road? For the time being, there's no main road for which we see that there's too much gathering or there's really people getting together. There are things that we're looking at on certain, if there's a lot less circulation, if there are a lot more pedestrians, then it would be easier to apply social distancing on a closed street rather than just on a sidewalk. So those are things that we're looking at with the City of Montreal, and that would allow us to allow people to continue going out for a walk regularly every day, but of course still respecting the 2-meter distance while they're walking. I imagine that you're talking about Saint-Laurent or Mont-Royal or Sainte-Catherine, for example. Well, the streets that often have, a lot more stores, even though there's very few stores that are open, it is places where people like to go having a walk. So yes, it could be things that we are thinking about without closing them down, but more making the space to walk, to broaden where we can walk. But those are things that will have to be considered together with the City of Montreal. My second question, the City of Montreal said at the beginning of the week that they were suspending Bixi until the authorization. Have you given that authorization on the 15th of April? We are evaluating everything. certain bicycle paths as well that may be open that will require moving cars, because we believe that between being on a bus or a metro or using a bike, I think that there's a lot less risk in using bikes. So we will find alternatives. For the Big C, however, we're still evaluating the situation, and it is possible that it be postponed, but we'll get back to you fairly quickly. Éric Plouffe, question?
M. Plouffe n'est pas là. On va passer à François Carabin du journal.
François Carabin.
Monsieur Carabin, vous avez droit à une question et à une relance. La parole est à vous.
Oui, bonjour. Donc d'abord, Dr. Drouin.
Dr. Drouin, I was wondering, the screening tests in Montreal.
Il y a eu plus de 11 000 tests si on se concentre sur la clinique de dépistage.
If we're talking about the screening clinic in downtown since its opening, I was wondering whether you were considering the opening of new clinics in Montreal in other sectors. Not for the time being. This is not a strategy that is being considered. Already the government last week had given certain priorities for those screening tests to certain groups that had been announced and were announced last week. And I think that the government will soon be announcing other strategies, including with clinics. So you'll probably get some news about this very soon on the screening strategies, anyway, very soon. But these are decisions that are being taken at the provincial level. So no, there's no clinic that will be opening in other areas of Montreal in the short term. A question on the Montreal airport. You had spoken 2 weeks ago with the mayor to complete the work of the customs officers. I've understood that your teams are no longer present at the airport, but do you still have contacts with the federal government to make sure that the message is being given to all travelers who are still coming in? As I mentioned last week, there was an enhancement, but of course the volume of travelers has decreased by quite a bit in the course of the past weeks. There was also a lot more interventions about the quarantine, and we're in contact with them, of course, because every time there is a person with symptoms, that person is directed to give a sample and put in quarantine by the federal government, and then we are the ones that investigate on that case. So yes, we are in communications with them, and from what we've heard, the measures are already in place and they're very active because we still get calls from them.
Deux questions de deux journalistes sur des thèmes similaires. Premièrement, une question de Jean Siak de la
Question of Jean Siak of La Presse, who would like to know whether public health wishes to recommend that the city cancels its festivities and its festivals this summer, at least until the 30th of June, as Toronto did. And also, second question, after Toronto's announcement, does public health believe that it will be necessary to cancel the Grand Prix? It is clear that right now the pause is for the month of April. That is what was announced by the government. Whether there will be territorial variations depending on the epidemiological evolution, it is very possible. We can already see that there are regions that are more isolated and that may experience this pandemic differently. This will be evaluated in the upcoming weeks with the Ministry and the City of Montreal. But we know, and it was announced, that it may be lengthy, the measures of distancing and the reintegration of our capacity of being together. So the withdrawal of the distancing measures will also be gradual. So at this stage, I cannot tell you for the 30th of June whether we'll have a jazz festival or a Grand Prix.
Alessandra Rigano de Radio-Canada. Madame Rigano, si vous êtes sur la ligne, vous pouvez poser votre question ainsi qu'une relance.
Oui, alors ça concerne les centres jeunesse. En fait,
The youth centers. Somebody, a young person who is in a youth center, should they be isolated in a somewhere else? The interveners say that there's not really any way of the person being isolated or to know whether they were sent or whether they were in contact with somebody who was. Well, if you're talking about the person who ran away, maybe there would be an observation of symptoms that should be indicated, but that I will be able to come back to you with my team that takes care of the youth centers more specifically, but I can't tell you right now. Another question about the employees and educators who work in the youth centers still. An employee who works with the public and is in contact with colleagues, and if they have tiredness and they have sore throat, they don't have a lot of symptoms, should they still go to work? Well, usually if somebody has symptoms that are like COVID, whether it's a sore throat, coughing, a headache, well, tiredness, I think that all people who are working right now are tired, so it would have to be tiredness outside of the common. But the word of the day, and it's not just for health workers, it's for essential workers in general. If you have symptoms, do not go to work, because potentially you may transmit. And essential workers are in the priority group to be screened, and that is why, so that we can have an answer quickly to know whether it's that or not, and then the person can reintegrate their place of work quickly if it is not linked to COVID-19. But first and foremost, we don't wish to infect our colleagues. That's essential to maintain our services.
Il nous reste deux journalistes en français.
We have two journalists left in French. Hugo Giguère from La Presse Canadienne. The interpreter apologizes. There's no sound. Sound is back. So the rate, is it high in the group of 20 to 39 years of age? No, I'm not worried, because it is also perhaps what explains why we have fewer hospitalizations. The cases that we have screened, at least for Montreal, I don't have the ages for the rest of Quebec, but for our region, so it's 41% of cases are over 50 years of age, but we do have 18% in the group 18 to 29, and we have, below people who are 50 and under, we have most people under 50. So is that worrisome? No. But what it means is that young people have to respect the measures of social distancing. It's even more important because they can be important vectors of transmission in the population. And in what we wish for, the objective is really to protect the most vulnerable people, such as the elderly and the people with chronic diseases or immunosuppressed. So it's not worrisome as such, that distribution, but I think that it reinforces the necessity that all people of all ages must respect the guidelines. Second question, we've spoken quite a bit about the homeless community. Many measures have been set up. Today, a lot of people who are homeless will receive a check that they will change to cash to be able to eat and go into stores. And many stores refuse cash right now. Is there really a danger in handling money? And could we ask those stores to accommodate this population? That's a very good question. Yes, we recommend to limit the usage of cash as much as possible in stores. But refusing to serve somebody who has no other means to pay, I think that for humanitarian reasons, there is certainly an alternative that should be taken as precaution. I'll get back to you on the recommendations and know that Health at Work, there was specifically a notice that was made to stores about the handling of cash. I'll be able to get back to you with more information, but that is clearly a very, particular situation.
Bonjour, Dr. Drouin. J'aimerais savoir.
I would like to know, you mentioned earlier on that right now there were 13 establishments for the elderly where there were at least 2 cases of COVID. I would like to know what sectors those are. Are we talking about CHSLDs, private residences? Are we talking about what are we talking about? No, these are CHSLDs, the vast majority of them, and I believe a few private residences for seniors, but it does not include, the towers, HLM, or rent-controlled housing. I don't know whether at this stage, if they're not on the website, it's because we do not necessarily make each place public. But I can validate that. What we have to keep in mind is that globally, these are the most vulnerable living spaces. And right now, a lot of efforts are being deployed to secure them and make sure that the health professionals who work within those living spaces are not vectors of transmission and that they apply the best control of infection measures. Where there are outbreaks, we know that it is more problematic, and we can see the consequences that are associated to that, but it's really the teams for the control of infections that are working very hard, and as the government announced, there will be extra measures in order to intensify the efforts within our CHSLDs. Moreover, the social acceptability difficult to understand. We saw that yesterday it was very nice outside and we ended up with parks that had big crowds. You said earlier on that the police would be called to be more present. The fines that have been mentioned, what kind of fines are we talking about, and do you expect that it will be done immediately? The way that it's working, and this PVM really is who has the mandate to apply and report to us what's happening. What is done on the field is an offense report, and the fine that is given will be evaluated later by the director of the justice system. And what the law says, the Public Health Act, it says that for an individual, a fine can be between $1,000 and $6,000, and for a moral person, so like a business that does not respect, it's from $3,000 to $5,000, I believe. So it really is, the fine is not given right away. It is evaluated by the criminal prosecution, who will then give that fine to the person. Last question in French. If you allow me, the first part of my question was the social acceptability about the people who are continuing to gather, whether it be gathering in parks or not giving others enough space when they're walking. Is there a problem with acceptability or even reluctance towards those measures? Well, we have a few surveys that have made about the acceptability of measures, and what we can see is that most of the population applies them and seems to recognize the importance of the said measures. There are still people which, as I said, we cannot allow ourselves in a pandemic such as this one to have exceptions, people who do not respect the measures. So quickly, with the the SPVM's reports, if we see that these are things that are pretty present, we are going to have to go towards more serious measures very quickly. As I was saying, with the epidemiological data that I have in the graduation of measures, if everybody respects them, it will allow us to keep certain individual freedoms of moving freely. But if we have a lot of people who do not respect them, and that is what these PVM will be able to give me as a report, well, then we will have to intervene more seriously and perhaps remove access to certain public spaces. What specific measures have been taken in the residences for the elderly and CHSLDs to limit outbreaks? There's the prevention guides, control and prevention of infection. So right now there's no visitors anymore, of course, and obviously the workers have to apply certain control measures. When there is a case, of course, the entire series of measures is set up to isolate the case, do the investigation of the contacts, isolate those contacts. So these are really guides of prevention that are broadcast and applied to all CHSLDs in their entirety, as well as the residences for the elderly. You will understand that this is a lot of work right now for the staff, and also right now what we're trying to do is to set up measures to avoid that the staff be moved around from one residence to another, so that they don't work in more than one place, in order to really avoid that the staff introduces the virus in those residences. Second question, were interventions made with non-essential recalcitrant stores or businesses? Not to my knowledge. To date, the SPVM has not reported to me any of those cases. The orders that I emitted were more with recalcitrant people in living spaces.
First question to Matt Damour from CBC. Matt, it's your turn to ask your question.
Hello, Dr. Drouin. You mentioned some new measures for what you're calling multiplexes, working with owners for sanitary measures, cutting down on visitors, and advising when there are cases. I'm just wondering if you can elaborate a bit on how that's going to buildings. With units, are we talking about how are we going to contact those owners, and is there a chance of getting fined if these measures aren't applied properly?
There's a first group of measures that is more sensibilization, so we're going to work with our partners to reach those owners and ask them to reinforce the measures. And we, at this stage, we are not looking at putting any fines or things like that. But the other part of the intervention is going to be more in multiplexes that have cases, and it's not a coercive intervention that we're putting in place. It's really an intervention to make sure that people who live in those buildings know the risk, and an intervention to make sure that we increase hygiene measures of hygiene and restrict the access to the building. But at this time, we're not putting fines. Of course, if we see that some owners do not collaborate, we could go there but at this time we're just putting in place this new intervention, but more in a collaborative way.
Second question, Matt.
And sorry, before I get to my second question, just to ask again, the size of multiplexes here, what are we talking about in terms of units or people living there?
We're still evaluating because we want to respect the, how do we say, the confidentiality. Of course, we have to see it's multiplex where we have common spaces. Those are the ones that we think may have a higher risk because you share elevators, staircase, and hallways. So, of course, if we have a duplex or a triplex, but there's a separate entrance, it is not a problem at all. So we'll see if it's a 6 or 10 units. But we're still evaluating with our partners the protocol that we're going to use.
And my second question has to do with personal protection and masks and that kind of equipment. And we've heard from the province that, there is a risk of running out. They're looking at the next week while they make more orders. What is the situation in Montreal? Is it looking like the rest of Quebec, and what are we doing to try to improve the situation?
I do not have, though. This is more on the other side, the other side of the health sector that is responsible of organization of healthcare. But I don't think that the situation is quite different than the Quebec situation. And so I think what the government has said does apply to Montreal, and the different solutions are going to come from the provincial government.
Thank you, Matt. Two journalists left in English. First of all, Aaron Durfeld from Montreal Gazette. You can ask your questions, Aaron.
Yes, good afternoon, Dr. Drouin. First question, I have two questions. First question, how many police officers and how many healthcare workers have tested positive to date?
I do have the number for healthcare workers. I have yesterday we had 121 healthcare workers who are cases that have been confirmed. They can, like I said yesterday, they can have been infected because they've traveled or been in contact with a case or at work. So we have 121. But for police officer, I do not have the number because and I think you should ask SPVM because some of the police officers do not live in Montreal but live, for example, in Longueuil. So we do not have the numbers for SPVM at this time.
Thank you. Second question. For Santé Montréal, in the coming days, from a logistical point of view, what's your biggest challenge going forward in the coming days?
Oh, that's a good question. I think the biggest challenge is going to take this decision if we reinforce some measures. So the biggest challenge is to have the information from the field or SPVM, what's in the information, the epidemiological information to see if we have to reinforce measures for Montreal. And we see that Laval has a situation that is increasing like Montreal with their the transmission of COVID. So we'll have to see if we have to increase some measures. And I think it's going to be, the decision are going to be made in the next couple of days with the government because we have to, it's Horacio Arruda, the national director, who decides. I do recommendation, but the decision is taken by the government.
Last question from
Does that mean closing a bridge between Montreal and Laval?
I don't think so because we are quite in the same situation as Laval as we're speaking, or we're close to the same situation as Laval.
Thank you, Aaron. Last question from Sarah Dubreuil, CBC. Sarah asks, is it safe, Dr. Drouin, to order food for takeout or delivery from restaurants right now?
We do recommend to accept food from delivery. What is important, of course, people can wash their hands, but what is important is in the business and the foods, the store who delivers, the people who make food. We have to make sure that they're not sick, that they wash their hands, and that all the proper the practices are protects the food. But we think that delivery, the food that is delivered is secure.
Thank you, Dr. Drouin. Merci tout le monde. Belle fin de journée.
Thank you, everyone. Have a good day.